A rapidly growing Ebola outbreak in the Democratic Republic of Congo is raising alarm across Africa, with health officials warning that the true scale of the crisis may still be unknown. World Health Organization Director General Tedros Adhanom Ghebreyesus has traveled to Bunia, the capital of Ituri province, the epicenter of the outbreak, as international concern grows over the speed of the virus's spread. Speaking to reporters, Tedros stressed that while international support remains important, local communities will play the decisive role in controlling the outbreak.
Looking forward to stop this Ebola with the community and under the leadership of the government. Of course, more logistic support, more financial support, but while focusing on the emergency, we should use it as opportunity to build the health system. Because in every crisis, there is opportunity, and that's how we should manage this outbreak. Speed up the support, and not only focus on emergencies, though they have to be prepared to use this as opportunity to build the health system. And at the same time, not just Ebola, the people need other health services. Yes, the international community is involved under the leadership of the government of DRC. At the same time, community ownership is important. That's why we're here to discuss with the community to see how the response is running, and if there are challenges, to help.
Congolese authorities say confirmed Ebola cases reached 225 on Friday, nearly double the 121 cases reported just 2 days earlier. More than 1,000 suspected cases have also been recorded, alongside over 220 suspected deaths. The outbreak is being driven by the Bundibugyo strain of Ebola, a rare but severe variant for which there is currently no approved vaccine or treatment. The World Health Organization has declared the outbreak a global health emergency, while Doctors Without Borders says it could be one of the fastest spreading Ebola outbreaks ever recorded. The outbreak is no longer confined to Congo. Neighbouring Uganda has confirmed 9 cases and 1 death, prompting concerns about wider regional transmission. Rwanda and Uganda have already closed their borders with Congo, while the United States has imposed travel restrictions on people recently visiting affected countries. The WHO, however, has warned that border closures are often ineffective and can discourage countries from reporting outbreaks quickly. Containing the outbreak is proving especially difficult because eastern Congo remains deeply unstable. Health workers have faced attacks from armed groups, including the Allied Democratic Forces and local militias. Tensions have also emerged over burial practices, with some communities resisting strict health protocols for handling Ebola victims. The virus has now spread beyond Ituri into North and South Kivu provinces, areas already affected by ongoing conflict and displacement. International assistance is arriving. The European Union has sent emergency medical supplies, while the United States has pledged more than $112 million for the response. But health officials warn funding remains far below what is needed. According to the Africa Centers for Disease Control and Prevention, available funding has dropped from nearly $500 million to just over $200 million. Meanwhile, researchers are assessing experimental treatments and a candidate vaccine, while health authorities confirmed the outbreak's first recorded recovery this week. For now, officials say the priority is simple: contain the virus before it spreads further across a region already facing conflict, displacement, and fragile healthcare systems. Tedros says Congo has defeated Ebola outbreaks before. The challenge now is whether it can do so again before this one grows even larger.